Hello, everyone, and welcome back to Talk Jessica, the podcast where we help you improve your English through real life conversations. I'm your host, Jessica, and today we have a very special episode for you.
And I'm Alex. Before we start today's very special episode, we have a small request.
That's right. If you find our lessons helpful, please take a moment to subscribe to our channel, like this video, and share it with your friends.
It really helps us grow and allows us to keep making these free lessons for English learners all over the world. Your support means everything to us.
Thanks for joining us, Alex. Today we're going to do something really practical. We're going to act out a conversation between a doctor and a patient at a medical clinic. This is such an important topic because everyone needs to visit a doctor sometimes, right?
Absolutely. Whether you're traveling, studying abroad, or living in an English-speaking country, knowing how to talk to a doctor is essential.
That's right. So let's start with some important vocabulary before we begin our role play. Alex, can you help me explain some key words?
Of course. Let's start with the word appointment. An appointment is a time that you schedule to meet someone, especially a professional like a doctor or dentist. For example, I have an appointment with Dr. Smith at 3 p.m.
Great example. Another important word is symptoms. Symptoms are the signs or feelings that show you are sick. For example, a headache, fever, or cough are all symptoms.
And we should mention prescription. A prescription is a written order from a doctor that allows you to get medicine from a pharmacy.
Perfect. Now let's also learn examine. When a doctor examines you, they check your body to find out what's wrong. The noun form is examination.
One more important word, diagnose. This means to identify what illness or problem someone has. The noun is diagnosis. For example, the doctor diagnosed me with the flu.
Excellent. Okay, everyone, now that we know these important words, let's start our role play. I'll be the patient, and Alex, you'll be the doctor. Are you ready?
Ready. Let's begin.
Good morning. I have an appointment with Dr. Wilson at 10 o'clock.
Good morning. Yes, I'm Dr. Wilson. Please have a seat. What brings you here today?
Okay, let me pause here for a moment. Did you notice Alex said, "What brings you here today?" This is a very common question doctors ask. It means, "Why are you visiting the doctor?" or "What's your problem?"
That's right. It's a polite and professional way to ask about your health concern. Okay, let's continue.
Well, doctor, I haven't been feeling well for the past 3 days. I have a terrible headache and a sore throat.
I see. Let me explain sore throat. When your throat is sore, it means it hurts, especially when you swallow. It's very common when you have a cold.
Thanks for explaining. So, doctor, what should I do?
Do you have any other symptoms? For example, do you have a fever or a cough?
Yes, I've been coughing a lot, especially at night, and I feel very tired all the time.
The word tired here means having no energy, feeling exhausted. When you're sick, it's normal to feel tired because your body is fighting the illness.
That makes sense. So, doctor, is it serious?
Let me examine you first. Can you open your mouth and say, ah?
Ah.
Okay. Your throat looks quite red and inflamed. Now I'm going to check your temperature.
Let's pause again. Inflamed means swollen and red because of infection or irritation, and temperature refers to how hot or cold your body is. Normal body temperature is around 37 degrees Celsius or 98.6 degrees Fahrenheit.
Good explanation. Let's continue. You have a slight fever. Your temperature is 38.5 degrees Celsius.
Slight means small or not very big, so a slight fever means the fever is not very high, but it's still there.
Exactly. Based on your symptoms, I think you have a throat infection. It's quite common this time of year.
Is it contagious, doctor?
Hold on. Let's explain contagious. If something is contagious, it means you can give it to other people through contact, coughing, or sneezing. For example, the flu is very contagious.
So, should I stay home from work?
Yes, I recommend that you rest at home for at least 2 or 3 days. You should drink plenty of fluids and get enough sleep.
Fluids means liquids like water, juice, or tea. Doctors often tell you to drink plenty of fluids when you're sick because it helps your body recover.
That's correct. I'm going to write you a prescription for some antibiotics and some medicine for your throat.
Antibiotics? What are those?
Antibiotics are medicines that kill bacteria and help fight infections. You need to take them exactly as I prescribe. Take 1 tablet twice a day for 7 days.
The word tablet means a small, solid piece of medicine that you swallow. Some people also call it a pill.
Yes, and twice a day means 2 times every day. You should take 1 tablet in the morning and 1 in the evening, preferably with food.
Okay, doctor. Should I avoid anything?
Good question. Avoid means to stay away from something or not do something. Yes, you should avoid cold drinks and ice cream because they can make your sore throat worse.
What about food? Can I eat normally?
Try to eat soft foods that are easy to swallow. Soup, yogurt, and mashed potatoes are good choices. Avoid spicy or acidic foods.
Soft foods are foods that are not hard or difficult to chew or swallow, and acidic means containing acid like oranges or tomatoes, which might hurt your throat.
Exactly right. Also, make sure you finish all the antibiotics, even if you start feeling better. This is very important.
Why is that important, doctor?
If you don't finish the antibiotics, the infection might come back, or the bacteria might become resistant to the medicine.
Resistant means not affected by something, so if bacteria become resistant to antibiotics, the medicine won't work anymore.
Perfect explanation. Now, I want to see you again in 1 week for a follow-up appointment.
A follow-up appointment is when you visit the doctor again after your first visit to check if you're getting better.
That's right. If your symptoms get worse or if you develop a high fever, don't wait for the follow-up. Come back immediately or go to the emergency room.
The emergency room is the part of a hospital where people go when they have serious medical problems that need immediate attention.
Exactly. Do you have any questions for me?
No, I think I understand everything. Thank you so much, doctor.
You're welcome. Take care and get plenty of rest. The receptionist will give you your prescription at the front desk.
Thank you, doctor. Goodbye.
Feel better soon.
Okay, everyone, that was our role play. How did you like it? Let's review some of the most important phrases we used.
Great idea. First, when you arrive at the clinic, you can say, I have an appointment with Dr. Name, or I'd like to see the doctor, please.
When the doctor asks what's wrong, you can say, I don't feel well, I've been feeling sick, or I have a problem with my body part.
When describing your symptoms, use present perfect tense. I've been coughing, I've had a headache, I've felt tired. This shows the problem started in the past and continues now.
That's a really important grammar point. And remember to be specific about when symptoms started, for 3 days, since Monday, for the past week.
Another useful phrase is, how long should I take this medicine? Or, are there any side effects? Side effects are unwanted effects that medicine might cause.
Good one. And don't forget to ask, when should I come back? Or do I need a follow-up appointment?
Before you leave, you should also ask, how much do I owe? Or, do you accept insurance? These are practical questions about payment.
Excellent. Now, let's talk about some cultural tips. In many English-speaking countries, it's normal to arrive 10 to 15 minutes early for your appointment to fill out paperwork.
That's right. And always bring your ID, insurance card if you have one, and a list of any medicines you are currently taking.
It's also important to be honest with your doctor about all your symptoms, even if you feel embarrassed. Doctors hear everything, and they need complete information to help you.
Absolutely. One more tip. Keep all your medical records and prescriptions organized. This helps when you visit a new doctor or travel.
Great advice, Alex. So everyone, let's do a quick review of today's vocabulary. We learned appointment, symptoms, prescription, examine, diagnose, sore throat, fever, contagious, fluids, antibiotics, avoid, follow-up, and emergency room.
We also learned important phrases like, "What brings you here today?" "I haven't been feeling well." "Do you have any other symptoms?" And "Take care and get plenty of rest."
Perfect. Now, here's your homework. Try to write a short dialogue between a doctor and a patient. Use at least 5 words from today's episode. You can share it with a friend or language partner.
And practice saying your symptoms out loud in English. Stand in front of a mirror and pretend you're talking to a doctor. This will help you feel more confident in a real situation.
Excellent idea. Remember, everyone, practice makes perfect. The more you practice these conversations, the more natural they will feel.
And don't worry about making mistakes. Even native speakers sometimes.
That's so true. Well, that's all for today's episode. Thank you so much for listening. And thank you, Alex, for being our guest today.
Thank you for having me, Jessica. It was a pleasure.
If you enjoyed this episode, please subscribe to our podcast and leave us a review. It really helps other English learners find us.
And if you have suggestions for future episodes, send us a message. We'd love to hear from you.
Stay healthy, keep practicing your English, and we'll see you next time on English Learning Journey.
Goodbye, everyone.
Bye!